Today, we're going to pull back the curtain on a really critical, but, often invisible part of the entire healthcare industry, medical coding. We'll get into what it is, why it's so important, and the clear path you can take to make it your career. Okay, so let's just start with this. Have you ever left a doctor's office and just kind of wondered, what happens after you walk out the door? How do all those notes about your symptoms, the diagnosis, and the treatment plan, how does all of that get turned into that formal bill that your insurance company sees? Well, that whole transformation, that is medical coding. And a great way to understand it is to think of a medical coder not as some data entry clerk, but more like a highly skilled translator. It's like they're fluent in two totally different languages: the super complex language of medicine and the really precise language of insurance and payments. So what is it exactly? Well, at its core, medical coding is the process of taking everything a doctor writes down, every single diagnosis, every procedure, even the medical supplies they used, and converting all of it into universal, standardized codes. These codes create a simple, clear record that, computers and billing departments can understand in an instant. This process creates what is perfectly described as a direct bridge of understanding between payers and providers. The coders, they're the ones building that bridge. They make sure the insurance company, the payer, fully understands the services the doctor, the provider, actually gave you. Now, if that bridge is weak, if a code is just a little bit off, a claim gets denied, the provider doesn't get paid, and honestly, the whole financial side of healthcare can start to crumble. So to really get what a coder does, we need to kind of zoom out a bit and look at the bigger system they operate in. We're talking about the financial engine that powers a whole healthcare organization. And that engine has a name. It's called Revenue Cycle Management, or RCM for short. It's basically the entire financial life of your visit, starting from the second you book an appointment, and it doesn't end until that final payment is made and your account is all settled up. And you can see that whole cycle right here. See how it kicks off with scheduling, then it moves to checking your insurance, and then bam, right in the middle, there's that absolutely crucial step: medical billing and coding. This is the exact moment a doctor's visit becomes a financial claim, all ready to be sent off to the insurance company. So yeah, a coder's day-to-day job is way more than just plugging in numbers. They're kind of like detectives, really. They have to use this deep knowledge of anatomy and pathophysiology to make sure every single code is spot on. Their work directly affects whether a doctor gets paid, for sure, but it's also about protecting the patient's long-term health record. I mean, one wrong code could get a claim denied, but it could also create a mistake in a patient's medical history that follows them for years. It's a big deal. Okay, so we've established it's a super important job with some serious responsibility. But what does it actually look like as a career? Let's take a look at the opportunities and the pretty clear potential for growth in this field. The career path itself is incredibly flexible. Once you're certified as a coder, you could work for huge multinational corporations, your local hospital, or even small private clinics. And honestly, one of the biggest draws for a lot of people is the number of work-from-home jobs available. That gives you a kind of freedom that's pretty rare in other parts of healthcare. And it's a career with a real ladder you can climb. You don't just stay a coder forever unless, you want to. You can move up to become an auditor or a subject matter expert. And from there, you can step into leadership roles like a team lead, an assistant manager, and go all the way up to a senior manager. And that career growth, it comes with some very real financial rewards. A fresher in India, for instance, can probably start in the range of 18,000 to 25,000 rupees a month. But what's cool is how fast that number grows. You get just a few years of experience under your belt, and you could be making 30,000 to 50,000. And with over 3 years in the field, salaries often shoot past 70,000 rupees a month. So right about now, you're probably thinking, all right, this sounds pretty good. How do I actually get started? Well, the answer, and really the key that unlocks the door to this whole profession, is certification. Your first big choice is going to be which group to get certified with. The two main players in this space are AAPC and AHEMA. In general, AAPC tends to focus more on outpatient coding, like what happens in a doctor's office, and it's often seen as a bit more accessible for people just starting out. AHEMA, on the other hand, is older, it's a nonprofit, and it's more geared towards inpatient hospital coding. But for anyone really looking to break into the field, the consensus among experts is pretty clear. The Certified Professional Coder, or CPC, certification from AAPC is hands down the most popular, globally recognized, and effective way to start your career. It's basically the industry's gold standard. See, medical coding isn't just about numbers and codes. It's a language. It's the language that allows the entire business of healthcare to actually work. It's a field with a really clear and rewarding career path. So the only question left is, are you ready to learn the language of healthcare?